There is a thought. If you're not part of the solution, then you're a part of the problem. The Burnstein Community Health Clinic is a glorious part of the solution. And we're going to tell you all about that clinic today, why it's so important to so many people, and why we need your help.
I'm Dana Burnstein, and I'm the CEO of the Gary Burnstein Community Health Clinic. The clinic offers anything from general medicine to gynecology, podiatry, neurology. We also have free dental and free pharmaceutical. Patients walk out of the clinic without paying a dime.
We help people that really have no other options. We don't take Medicaid, we don't take Medicare. So we reach out to people who have no insurance. And basically, it's the working poor. It's people who are trying very hard to get ahead, but they just can't.
I've been a patient here for a few years now, and about 2003 I was diagnosed with cardiomyopathy, congestive heart failure. I take a lot of chronic medication, and thanks to the clinic I get all that medication. I get to see a doctor once a month, so I'm extremely grateful to the clinic for all the medical services they provide me.
A lot of these people had real careers, real jobs that were very successful, and because of the downturn in the economy have just lost their jobs. They went into foreclosure, they lost everything. It's something that could happen to any one of us due to injury, accident, or loss of career.
My husband, Gary, had a dream that everybody should have free access to medical care. Gary was a cardiologist at Oakland General Hospital. He was as much a friend as he was a doctor. Unfortunately, he didn't live long enough to see the clinic come to fruition. But thanks to the Grace Centers of Hope and some tireless efforts of Kensington Church, the clinic came to be. The need for financial aid has grown tremendously because the number of patients we see has grown tremendously. Last year we had 4,400 patient visits. So that was quite an increase from the 14 we used to see per week the first year we were open.
The need for us won't go away. And that's what the scary thing is. People are starting to get hesitant to fund free clinics thinking the government has got the solution. But there are so many people that are going to be left out in the cold and still not have help that it's scary.
We need physicians, we need pharmacists, we need dentists, PAs, nurses, lay personnel, hygienists. There isn't anybody who can't help us. Although we get a lot of medication free, there are a lot of medications that we still have to pay for. There are a lot of services, lab work that we have to pay for. So the need for funding grows as the economy slows.
You never know where you might find yourself in a situation where you lose your job, or you be fallen prey to a chronic illness, get into an accident. And if you don't have insurance, where do you go for help? People need to realize that it can happen to you at any time of the day, any point in your life. You need to realize the benefits of having a free clinic and the services the clinic provides for people in need.